here's your host, Chelsea Edwards.
Welcome to another episode of Chattin with Chelsea. I'm your daytime bestie, Chelsea Edwards. Ladies, if you have ever thought heavy periods, pain, and other inexplicable symptoms are just a part of being a woman, well, we are setting the record straight today. We are chatting about fibroids. We are getting into the latest treatment options, everyday products that could be putting you at risk, and we're talking about the symptoms, because some of these symptoms you can't see, but some of them you can't miss.
This is what I look like with 12 fibroids and 6 ovarian cysts 2 weeks ago. As you guys can see right here, it's my rib cage and my stomach is protruding forward. I was experiencing heavy menstrual cycles and I was completely anemic. My stomach was completely disformed.
Ooh, yeah, those are some very noticeable symptoms there. Yeah. Welcome back to Chat with Chelsea, Dr. Rosalyn Miller.
Good to be here.
Chief OB-GYN over at Houston Methodist Sugar Land Hospital. Yes. Thank you for returning, because even though we had a show previously about fibroids, this discussion needs to be had over and over.
I agree.
Especially when it comes to the statistics.
I agree.
More than, or 50% of Black women will get fibroids by the time they are 50.
It's higher than that.
Ooh.
So most women will be diagnosed with fibroids. About 70% of women will be diagnosed with fibroids by age 50. For Black women, it's up to 80%.
Wow.
So it's higher. It's a lot higher.
That is insane to think about. Also, a lot of women who I know who have dealt with fibroids, they did not know anything about fibroids until they found out that they had them.
Right.
So let's talk about these symptoms, because in that video, we could see a protruding stomach, but there are all kinds of symptoms women can be experiencing.
There are a lot of symptoms with fibroids, and a lot of it depends on where they're located and really how big they are.
Okay.
The biggest symptom that brings women to see me is heavy bleeding. There may be pelvic pain, or even when it comes time for them to decide to have children, they may have issues with infertility, issues with recurrent miscarriages, things that will prompt us to get an ultrasound, and that's how we'll find out.
Ah, okay, so it can definitely affect your family planning.
Absolutely.
What else are we dealing with? Pain?
Pain, just overall quality of life. So you have women who are anemic, women who are constantly and chronically fatigued, not really understanding why they're fatigued. You know, things where you have abdominal bloating, this mass there. So just overall impact on your quality of life.
And you say anemic, they could really be losing a lot of blood.
A lot, to where you require either IV infusions, iron infusions, or you can even require blood transfusions, and that's when it's really serious.
Yeah. The other thing is sometimes we as women will just think, okay, well, I'm just having a heavy period. Like this is just, this runs in my family or whatever.
Right. We normalize it. You know, we think about our moms had heavy periods, and most times, you know, maybe a situation where your mother had a hysterectomy in her 30s, so you're not quite sure what's normal, what's abnormal, but this has always been what you've experienced, and so you don't think to bring that to the attention of your gynecologist.
Is it always like multiple fibroids happening?
No, not always, not always. And that's the biggest thing with fibroids, is that they're unpredictable. So I can have someone who has a huge fibroid off to the side, and essentially all she feels is a little bulge. I can have a patient who has 3 or 4 and she is saturating a pad an hour every time she has a cycle. So they're very unpredictable. It doesn't always have to be multiple. Sometimes there may be one just large fibroid. So we never really know until we do an ultrasound or some imaging studies.
Yes, and then typically from what I've heard, women will go into surgery to get these removed.
There's the beauty of it is we have a lot of different treatment options, and when I look at deciding on a treatment option, I look at what my patient's goals are. So a lot of it depends on age, it depends on the number of fibroids, and it depends on where she is in her reproductive journey. Does she have children? Is she planning on having children? You know, is she done with having children? So then we can talk about medications, we can talk about hormonal therapies, your birth control, we can talk about things like conservative treatment. If they're small, they're not causing any issues, we don't always have to do something. We can talk about surgery in terms of myomectomy, where you just remove the fibroids themselves, or a full hysterectomy, where you take out the entire uterus. We also have things like uterine artery embolization. That's a procedure that's done in radiology where they put these kind of pellets into the blood vessels that feed the fibroids. By doing that, you cut off the blood supply and it helps the fibroids slowly shrink. It's not an instant shrinkage. I get that a lot from my patients where they'll say, I had this embolization done and I still feel, but it's a very slow, almost to the point where it's just they're dying off slowly.
Is that a new development?
No.
It's been around.
It's been around a long time. So there's plenty of options, which is why if you have uterine fibroids, you really want to have that conversation with your physician in terms of what are the best options for me. And if your physician is choosing one particular option, ask why. Now, why are we choosing this one and not any of the others? So you really want to make sure you have all of those questions with you when you go talk to your doctor.
Okay, absolutely. You're giving us the things that we need to know, Dr. Miller, but we need to know more. So we're going to take a quick commercial break and we will be right back with more chatting about fibroids. Welcome back. Now, I have to give you a warning in case you are watching us during the day, eating your lunch, or you have kids in the room. We're about to show an image that can be considered very graphic. Dr. Miller is here educating us on fibroids. My question when we were planning the show is, what does a fibroid even look like? So we have this picture we're gonna throw up here, and this is a pretty large one.
It's a large one.
15 centimeters.
Yes.
So somebody was walking around with this, just moving about life.
Right. And usually women think of it in terms of pregnancy. Like I look this many months pregnant. That would be about 4 months, about 4.5 months. You know? Yeah.
Okay.
Yeah.
And then it has these little tentacle things on it as well. What are those?
Those were actually her fallopian tubes. Those are actually fallopian tubes. So one of the things that we do, and this is totally, off subject, but when we do a hysterectomy, nowadays we try to remove the tubes, even if the woman is keeping her ovaries. Because what we found, or research has shown, is that by removing the tubes, we actually decrease the risk of ovarian cancer in the future. So if I have a patient who wants a hysterectomy, we take the uterus out, but then I try to get those tubes out as well.
And these are for patients who are done having kids.
We're done with kids, not even thinking about, having a baby, anything. So the tubes are of no consequence.
Okay. Are there any updates or new options that you're seeing, especially for women who do want to have children in the future?
I think what we're seeing is not necessarily new, information, but it really is giving her more onus over what's going on in terms of lifestyle. So things that you can do to optimize your gynecological health all the way around. And that is things like your diet. So we know that inflammation increases oxidative stress and can cause, higher amounts of bleeding and things like that. So eating more anti-inflammatory foods, that's your berries, even eating more high fiber foods, so like your broccoli, your Brussels sprouts. So by eating more high fiber foods, your gut can kind of eliminate some excess estrogen. And we know that fibroid growth has been related to excess or increased estrogen amounts. So eating more fiber, eating more anti-inflammatory foods. And the other thing is maintaining a healthy weight. Again, estrogen can impact a fibroid's growth. So we know that estrogen can also hide in fat cells. So by maintaining a healthy weight, that also helps. So those are the things that I like to try to educate women on. These are things that you can do to help optimize your gynecological health all the way around.
Okay, less fat cells, less risk, hopefully. Okay, that's what we're going for. All right, so some people are watching us live on YouTube as we are recording this show, Dr. Miller. And we had a note from Ark and Covenant of Beauty. So this is a hairstylist who says that she learned from a Black scientist that fibroids can be caused by relaxers. I know a lot of research has come out over these past few years. What else should we know when it comes to those relaxers and perms?
In general, fibroids and what causes fibroids is so multifactorial. We know that genetics plays probably the biggest role. So genetics plays a huge role. Again, hormones play a huge role. inflammation plays a huge role, but we also know that environmental factors can play a role, and I think that is what we're getting to when we talk about lie versus no lie relaxers and all of that. The issue is we need the data and we need the research, and so the more women are vocal about wanting answers, the more we can get dollars put toward research so we can absolutely answer these questions.
Yes. Now, I know a lot of us Black women did grow up getting the relaxers and all of that on a regular. Are there additional environmental factors that are making Black women more susceptible to having fibroids?
Something that's interesting is there's research right now that's looking at vitamin D deficiency. So Black women are more likely to be vitamin D deficient. And so there's been a link or correlation between vitamin D deficiency and uterine fibroids. That's not to say that by taking vitamin D, I won't have fibroids, but it just shows us that this is so much more complex than what we know.
Okay, yeah, a lot of factors that we have to keep an eye on. Are there anything, is there anything else that you want the folks to know when it comes to fibroids and getting the message out there? Because so many people still don't really know what these are.
You don't have to live with pain. You don't have to live with heavy bleeding. If you have these things, it is imperative that you speak to your physician about it, because there are things that we can do. There are ways that we can partner. We can look at lifestyle changes. We can look at medicines. We can look at surgical options. But the biggest thing for me is getting women to take some ownership over their health and understanding that they have options, that they do not have to live with this at all.
Absolutely. Thank you so much. All right, we got to talk more about these lifestyle changes, because the things in your home and the things you're using on your body could be affecting this. So we're going to take a quick break. We will be back with more information you have to know about fibroids. Be right back. When it comes to fibroids, there could be things that are exacerbating them, that are sitting right on the counter in your home. So we've got Tiy Bilbo, founder of Her Womb Wellness. That's a mouthful, but I got it. Okay. And Dr. Katashia Kendrick. Okay, so both of you, let's start here. Both of you have your own fibroid stories. So Tiy, I'll start with you. When did you find out you had fibroids?
I found out in 2018. I had to go to the emergency room because I was having really bad cramps. Like, I was on the floor.
Oh, wow.
Yeah, so my mom rushed me to the emergency room. They took x-rays and everything, and he just came back and said, oh, you have a fibroid flare-up. I'm like, what is that?
I didn't even know they were in there.
I didn't even know, yeah. I'm like, okay, so what else do I do? Gave me some tramadol. That was too powerful for me. I couldn't see. I was like stumbling all over the place. Okay.
Was that just for the pain, or what?
I guess, just for the pain.
Okay.
Yeah, and then I'm like, this is too much. I was like, let's cut it down. I'm like, no, I don't want to take it. So that's when I started my holistic journey of alternatives versus, the surgery. Because I was like so against the surgery at first, but later on learning, I'm not against the surgery because I had surgery.
Okay, so you had to, are you also incorporating the other things that you found out as when it comes to the holistic approach?
Yes, definitely. I'm a holistic junkie. I can tell everybody I'm a holistic junkie. Food, what I put on my skin, what I put in my hair, the things that I'm thinking, making sure I'm not overdoing it with exercise. So it's a lifestyle.
Okay. We've got a lot to learn from you. I know we're going to get some nuggets today. Dr. Kendrick, I want to hear about your fibroid story as well.
My story started in 2002. I was in pharmacy school, and really I was in so much pain, I normalized it. Everyone told me it was normal. All the bleeding, the cramping, and the heavy blood, the thick blood clots, normal. So I kept moving until I was in an exam in my first year in pharmacy school, and I bled through my clothes into the chair.
Oh my
And gosh. I was too scared to get out the chair because all my classmates were there. I stayed there until everyone left, and I ran out the back door, and I called my mother. I'm like, something is wrong. And I was going to school in New Orleans, had to drive home to Tennessee. And that's when I went to the doctor, and she told me I have fibroids. We can just have a surgery and you'll be good. She told me they wouldn't grow back. And of course, we know that's not true.
Right.
And I've had since then two surgeries. I had 2 myomectomies, the removal of the fibroids, and then my last surgery was a hysterectomy at 36 due to my fibroids and endometriosis. Never been pregnant, so had a long journey with fibroids.
And how many fibroids have they taken out from you?
Over 100. So the first time when, 40, 50 the very first time, because my second surgery, that's when I thought I was 6 months pregnant. Well, everyone else did. I knew I wasn't pregnant.
Right.
But my stomach was protruding and so much pain. And then the last surgery, the second surgery, I also learned I had endometriosis and a lot of pain there. And then my third surgery, just couldn't take it anymore. And the bleeding, the pain, I was missing work. It really affected my life. I lived out of my car because I had extra clothes, pads, because I messed up my clothes at work. So I knew something needed to give. And in 2016, I had my last surgery.
Wow. Okay. So through both of your experiences and the research that you've done, you've also found out that there could be things lurking in our homes that are adding to this fibroid problem. Okay. So what kinds of things are we talking about?
So I call them the silent endocrine disruptors. So they're xenoestrogens. So, you know, Dr. Katashia can.
Yeah, xenoestrogens. They're fake hormones, as I call them. These are chemicals found on the outside in the environment that can actually affect us, meaning that it can mimic estrogen in our body. So it's acting like it's estrogen when it's not. So your real estrogen and this fake estrogen, they're binding, fighting each other, trying to get in and get certain things going on. And when that happens in your body, it can affect heavy bleeding, fertility, your mood, and so many things. And it can be found in products that we brought in today to even, I'll let Tiy explain about how it can affect that.
Yes, just everyday products that we're using, you know?
Every day.
Yeah,
Lotion.
see candles and
Candles.
lotion.
Okay, so this is candles. Yes, this is a big one. We love our candles. We love our smell goods,
We
right?
do. We
Right? But we don't look at the bottom and see what's in there. We gotta read the labels.
The preservatives.
The preservatives. You have fragrances. So fragrances, they can have over 300 plus chemicals in there.
Wow. So what are we supposed to be looking for? Because I still want the house to smell good.
You can still do that. You can get a diffuser with essential oils. You can get a candle that's made out of coconut or beeswax, not soy at all, because it's sprayed with pesticides and all those kind of chemicals. So now you're inhaling all of this.
Yeah, as it burns, you're just breathing it right in. It's so crazy to think of. Okay.
Yeah.
So, I mean, you know, it's logical, but it's something people overlook all the time.
Even with a candle, we think about when you wash your clothes, the washing detergent, even your dryer sheets, all those things as well have these endocrine disruptors or these chemicals in it that can actually affect you as well.
What do we do without the dryer sheets?
I know, but you can use wool balls. You've probably seen those. You can sprinkle some essential oils on your balls.
All
I
right.
know this sounds weird what I just said. On your wool balls.
Clip that.
On your wool balls, and be able to put that in your dryer to help with your clothes smell pretty good, like an orange or lemon oil.
Nice. Okay, and then you brought up lotion as well.
Yes, lotion, because we go to Bath and Body Works and we're buying everything there, but we're not looking at the ingredients. So like I said, you're gonna have those chemicals in there in all of those different products. So we're putting it on our skin, and which is the biggest organ. So it's seeping into our bloodstream. And we don't want to have that, so we want to switch to cleaner alternatives. So start small with changing things up. Like this is hair dye, this is henna. So I use henna instead of the chemicals because I don't want that, you know, seeping into my bloodstream and disrupting my hormones.
Okay, does that cover grays?
Yeah, but
Okay,
that's why I got it.
A couple of weeks, right?
Yeah, a couple of weeks, like 2 weeks.
Okay, good to know.
So, yeah, and they also have the powder form, and then the pads that we're using. We want to use organic pads.
Yes.
The other pads have all the chemicals, the bleach in it. So just think about it. You're wearing a pad 8 hours for what, 5 days, 7 days, and those chemicals are steeping.
Yeah, and especially when you put a tampon in.
Yeah, tampons are no-no.
Yeah.
I don't do tampons because you're not having a natural flow. It's stopping the natural flow. So always organic pads. When I gave out my pad list to a couple of ladies, it's like, oh, I'm switching to this. My period has, it's not as heavy. The flow.
Interesting.
Yeah.
Wow. Okay. Anything else that we need to keep an eye out for?
Like I said, this is a lotion. This is a little bar.
Okay. All right.
And this is coconut oil, shea butter that I put on my skin.
So that's a good alternative.
It's a good alternative. Shea butter, jojoba oil. Those are all good to put on. You can add some essential oils. You want to smell good. Go ahead.
Yep.
Yeah, I'm really big when it comes to essential oils, but I also remember that, for me, I took baby steps until, you won't be able to 100% eliminate all these things because it's in our environment, it's around us.
Right.
So baby steps and learning how to be able to do it just step by step. It's not that hard.
Have there been changes that you two have noticed that you can attribute to these switches that you've made?
I believe so. With me still living with endometriosis, I noticed a major difference. Now, of course, my husband did not like all the changes because he loves to dry his sheets and those different things. But I noticed that just with the pain itself, outside of I went holistic, like I said, later, trying to understand what was going on, some of the things I needed to do, but my pain and my flare-ups with endometriosis totally went down. I haven't had a flare in over a year.
Wow. Okay, well, congrats. Yeah, let's give it up for that. All right. Well, thank you, Tiy. Thank you, Dr. Kendrick. Such great information and real stuff that we can make changes with. All right, guys, we got to take a quick commercial break. We'll be right back after this.
Come back to me.
Thank you to all the guests who came today to educate us. Dr. Kendrick, where can the folks find you?
Yes, drkatashia.com or Dr. Katashia on all socials.
Okay, and then Tiy, I know you have an event coming up.
Yes. So it's our 5K first annual fibroid walk for awareness, September 19th at Tom Bass Park. You can find more information at heroonewellness.org.
Yes, and Dr. Miller.
Yes.
Where can the folks get more info from you as well?
You can find me most times at my practice, Houston Methodist in Sugar Land. I'm also on social media, Dr. Rosalyn, Instagram, LinkedIn, also on Substack.
Excellent. Okay, take care of your bodies, take care of your minds. You know what's good for the mind? Watching Chattin with Chelsea on YouTube. So subscribe over there, click the bell for notifications. Keep up with us on social, Chelsea Fox 26, and we'll see you on the next Chattin with Chelsea.